In this video, we are going to discuss a patient of 31 years old having a long-standing hair fall and hair loss history of 10 years with the medicines and nothing worked out for him actually. He underwent a hair transplant. He was almost a grade 6 Norwood baldness, and in this video, we are going to discuss his journey, how he regained his confidence and the look by getting a hair transplant done with us. I am Dr. Satya Saraswat. I am a member of American Board of Hair Restoration Surgery and a member of ISHRS International Society of Hair Restoration Surgery, otherwise a plastic and a cosmetic surgeon working in the field of hair loss and hair transplant since 2006. Also, we will discuss about our artificial intelligence based app Saraswat Hospital App and how it helps you in planning and decision making about your hair transplant. Now let's discuss this Saraswat Hospital App. By using this app, downloading it, putting your pictures and feeding some information into that, and based on our feedback, you get a peek into the kind of results you can expect after your hair transplant. It's absolutely free of cost and is available on both Android as well as Apple iStore, and the links to this is given in the description below from where you can download this app for your use. We request you to subscribe to our channel so that you can keep on getting such useful, informative videos which will be helpful to you in your hair loss journey. As we have discussed, he had a very long-standing history of hair fall. For around 10 years, he had tried some treatments, some medicines, but unfortunately it did not work out for him, as is case in some of the patients that medical treatment does not work out in each and every patient. We planned out his hair transplant surgery. So as is customary before planning, we did a detailed trichoscopy for him in the donor site, and we found out his average donor site density was 80 follicular units per centimeter square. His average thickness of hairs was 0.078 millimeter, which was again very good. His total number of grafts which were available in his donor site were around 11,000, and his coverage value was around 12.6, which is slightly above average. His average number of hairs per follicular unit was around 2. Based on this data, we planned out a coverage. As you can see from the pictures, he has a small thin fringe of hairs in the hairline existing, so we planned out his hair transplant just beyond that fringe of couple of centimeter of hair which he has preserved in spite of having an extensive baldness in the back side of the scalp. Based on this, we planned a coverage of the front hairline and the mid scalp up to the transition zone. His recipient area was around 92 centimeter square, and we did plan out a density of 35 follicular units per centimeter square for this. So this came to around 3,220 grafts for him, which we had planned for this area. Do give a like thumbs up to this video if you like the way in which we plan our hair transplant for each and every individual patient. Then we planned out a procedure for him on a particular day. He came as is customary. We did his sensitivity test, gave antibiotic, did ECG for him, marked the hairline, trimmed his hair with a 0 number trimmer, and this hairline was shown to him. He was okay because we had already discussed this with him in his consultation. Then we gave local anesthesia using very fine needles, which are insulin syringes, very fine 30 gauge needle, use vibration devices to give local anesthesia. And after the local anesthesia was completed, we gave him tumescent solution in the recipient area where the transplant is planned. After this, we started creating the slits for him. After this, we changed his position, extracted the grafts using FUE technique, and on the counter you can see the number of grafts extracted in his case. We maintain absolute transparency in terms of number of grafts extracted because the costing of hair transplant goes by the number of grafts which have been transplanted in each and every patient. After this, the grafts were sorted into 1, 2, 3, 4 hair grafts, and then our team inserted the grafts into the slits which we had already created. After this, we gave him detailed instruction how to follow up and what care and precautions you have to do. After this, he is given a kit or a pack of medicines which he has to take for 4 to 5 days. This include antibiotics and painkillers and multivitamins. And he came for the first shampoo after 72 hours, 3 days, and then we did a gentle shampooing for him. Then he did the rest of the shampooing at home. Then he started coming to us at regular interval at 3 months. Then here you can see his photographs at 4 to 4.5 months with a combing video. Now you can see on the screen his 5.5 month pictures as well as the combing video of his transplanted area and the donor site as well. You can make out the natural results which he has achieved out of this hair transplant, which can only be achieved when the planning and the execution is perfect. Otherwise, you can't achieve these kind of results. His donor site also looks unharmed, looks very natural the way it was before the surgery, and overall patient is extremely happy with this hair transplant, which has changed his face, transformed his life, and we are also equally happy. If you are also planning a hair transplant for yourself, please call us at the number mentioned, or you can WhatsApp your pictures on this number, and our team will try to reach out to you and explain to you about the intricacies of the hair transplant and what suits you based on the feedback of after getting the feedback from us. Before finishing this video, I would like you to take away these sort of messages from our side which will be helpful to you in guiding your hair transplant. Whenever you plan your hair transplant, please ask the doctor or the team what all steps are done by the doctors and what all steps are done by the team. Ideally, and as per the protocols, slit making and extraction should be done by the doctor. The involvement of doctor should be there, and the insertion can be done by the technical team. Point number 2 is always check out the name of the doctor, their degrees, their credentials, who they are, rather than just going for the package or a price or a discounted price. Point number 3 is always ask the clinic about the transparency of number of grafts. How do they maintain the transparency? How do they show you the number of grafts they have taken out? Point number 4 is please ask them what kind of machinery equipments the clinic is using. Please share this video with any of your family members, friends or colleagues who are planning out a hair transplant for themselves or even their near and dear ones. To watch another such result of our hair transplant patient, please click the video on the left, and to know more about medical treatments for hair loss, please click the video on the right.